Occupational Therapy Intervention Process Intellectual Disability Case Study by Amy Villarrubia. Gabriela is a girl who is 5 years and 6 months old. She presents with the diagnosis of moderate intellectual disability. She is currently attending kindergarten. As a parental report, Gabriela is the product of a full-term healthy pregnancy with no perinatal complications reported. She lives with her parents and two brothers in a two-story house. The mother expresses concerns about her academic achievement, behavior, social interaction, and independence in activity of daily living such as eating, dressing, and self-care. According to Gabriela's mother, she has difficulty identifying letters and numbers 1 to 10, and she is unable to print her first name. She also has tantrums and aggressive behavior when she needs to sit to do her schoolwork, which has worsened over the past 6 months. Additionally, she exhibited language delay, poor socialization skills, and poor eye contact. Further, the mother reported that she loves to play with the family cat and she also enjoys playing in the school playground. Client occupation performance concern. Gabriela demonstrates poor academic performance secondary to decreased cognition, attention, and writing skill, and unable to identify letters and numbers 1 to 10. Difficulty with transitions and emotional regulation. Poor social interaction secondary to delay in reaching developmental milestones like verbal and communication skills. As per mother reported, she has difficulty performing ABL appropriate for her age. Occupational performance strengths. Gabriela is intrinsically motivated to play with her pet and enjoy physical activities. As per case study, Gabriela has no delays or impairments in her gross motor abilities. Characteristics of the diagnosis. The following are important characteristics and underlying factors of ID that need to be addressed during the evaluation process. Impairment in intellectual functioning, slower learning, behavioral problems, difficulty with communications, and social skills. Developmental frame of reference. Intellectual disability is a neurodevelopmental disorder characterized by limitation in intellectual functioning and adaptive behaviors. A child with ID has problem mastering and integrating skills and behavior acquired in previous stage of development. The child with ID also has difficulty with adaptations. As such, the developmental frame of reference will be appropriate for an individual with ID because it will address problematic areas and skill deficits or challenges in occupational participation. Additionally, expose the child to repetitive skill practice to promote brain plasticity and learning. Cognitive behavioral frame of reference. The cognitive behavioral frame of reference is used in intervention to address behaviors and cognitive process that limit Gabriela's occupational participation. Children with ID have challenges with behaviors, thought, emotion, and other cognitive deficits. It will be appropriate to address harmful habits and focus on the client's strengths for a compensatory mechanism to promote occupational participation. Furthermore, allow the child to practice problem solving and make their own choices with a simple task to promote a sense of accomplishment. OT process chart. Applying the chart to Gabriela's case provided a formal and guiding thought process detailing the factors hindering performance and strengths. The process facilitates client-centered care by identifying the client's strengths and necessary for creating interventions to address what is hindering occupational performance. Identifying the client's concern and strength as well as the characteristics of the condition is needed when choosing a frame of reference that may be applied during the intervention. Therefore, it is an essential aspect of the occupational therapy process. Thank you for your attention.